Depression is more than just feeling sad or down. It's a complex mental health condition that goes beyond temporary feelings of sadness or grief. While everyone experiences ups and downs in life, depression is a persistent feeling of sadness and loss of interest that can affect how you think, feel, and handle daily activities. It's a serious medical condition that affects your thoughts, feelings, and actions. Depression can manifest in various ways, including changes in sleep patterns, appetite, energy levels, concentration, daily behavior, or self-esteem. It can also be accompanied by physical symptoms such as chronic pain or digestive issues. Imagine a heavy weight on your shoulders, making it hard to enjoy things you used to love. This weight can feel like an invisible burden that you carry with you everywhere, making even the simplest tasks feel overwhelming. It's not just about feeling sad. It's about feeling numb, empty, and disconnected from the world around you. That's what depression feels like. It can make you feel isolated and alone, even when you're surrounded by people who care about you. The emotional pain can be so intense that it feels like it will never end. It can make it difficult to work, study, sleep, eat, and enjoy life. Everyday activities that once brought joy and satisfaction can become daunting and exhausting. You might find yourself withdrawing from social interactions, losing interest in hobbies, and struggling to find motivation to get out of bed in the morning. It's like being stuck in a dark tunnel, unsure of how to find the light. This darkness can feel all-encompassing, making it hard to see a way out. But it's important to remember that this tunnel is not endless, and there is a path to recovery. But remember, depression is treatable, and there is hope. Don't ignore these signs. Reaching out for help is a crucial step towards healing. It's okay to ask for support from friends, family, or mental health professionals. You don't have to go through this alone. Reach out to a mental health professional. Therapy, medication, and lifestyle changes can all play a role in managing depression. A mental health professional can help you develop coping strategies, work through underlying issues, and provide the support you need to start feeling better. With the right help, you can feel better and start enjoying life again. Recovery is a journey, and it may take time, but it's possible. By taking the first step and seeking help, you can begin to reclaim your life and find joy once more. Remember, you are not alone, and there is always hope for a brighter future. Depression can manifest in different ways. It's not always easy to recognize, as it can vary greatly from person to person. Sometimes it can be subtle, creeping up slowly over time, while other times it can hit suddenly and intensely. You might feel a persistent sadness, emptiness, or hopelessness. These feelings can be overwhelming and make it difficult to get through the day. It's not just about feeling sad, it's a deep, pervasive sense of despair that doesn't seem to go away. Maybe you've lost interest in things you used to enjoy, like hobbies or spending time with loved ones. Activities that once brought you joy now feel meaningless or burdensome. This loss of interest can extend to all areas of life, making it hard to find motivation. Your sleep and appetite might change. You could be sleeping too much or too little, eating too much or too little. Insomnia or excessive sleeping can disrupt your daily routine, and changes in appetite can lead to weight loss or gain, further affecting your physical health. You might also have trouble concentrating, making decisions, or remembering things. This mental fog can make it difficult to perform at work or school, and even simple tasks can feel overwhelming. It's like your mind is constantly in a haze, making it hard to focus. These are just some of the common symptoms of depression. It's important to remember that everyone experiences depression differently, and you might have other symptoms not mentioned here. Recognizing these signs is the first step towards getting help. If you recognize these signs in yourself, know that you're not alone. Many people go through similar experiences, and it's okay to seek help. Talking to a therapist or joining a support group can provide the support and understanding you need. Many people experience depression, and there is help available. Reaching out to a mental health professional, calling a hotline, or joining a support group can make a significant difference. Remember, seeking help is a sign of strength, not weakness. You don't have to face this alone. Depression doesn't just affect your emotions, it impacts every aspect of your life. It can strain your relationships with family and friends, making it difficult to connect with them. Your work or school performance might suffer as you struggle with concentration and motivation. Simple tasks like getting out of bed or taking a shower can feel overwhelming. Depression can also manifest physically. You might experience fatigue, headaches, body aches, or digestive problems. It's important to remember that these physical symptoms can be just as real and debilitating as the emotional ones. The causes of depression are complex and varied. It's often a combination of factors like an imbalance in brain chemistry, genetics, life events, and personality traits. Sometimes a difficult life event, such as the loss of a loved one, job loss, or a serious illness, can trigger depression. Other times it might seem like there's no clear reason. The important thing to remember is that depression is not your fault. It's not a sign of weakness, and you don't have to go through it alone. Section 5. You are not alone. Seeking help and finding support. Seeking help for depression is a sign of strength, not weakness. It takes courage to acknowledge that you're struggling and to reach out for support. The first step is often talking to your doctor or a mental health professional. They can help you understand what you're going through and recommend the best course of treatment for you. Remember, you don't have to suffer in silence. There are people who care about you and want to help. Section 6. The path to healing. Treatment options for depression. The good news is that depression is treatable, and there are effective treatment options available. Therapy, medication, or a combination of both are commonly used to treat depression. Therapy, such as cognitive behavioral therapy or CBT, can help you identify and change negative thinking patterns and develop coping skills. Medications such as antidepressants can help regulate brain chemicals that affect mood. Finding the right treatment plan might take time, and it's important to be patient with yourself. Remember, recovery is a journey, not a race. Section 7. Taking back your life. Coping mechanisms for depression. Depression can feel overwhelming, but there are ways to regain control and improve your quality of life. While seeking professional help is crucial, there are also things you can do on your own to manage depression symptoms and improve your well-being. Therapy and medication can be very effective, but self-care practices play a significant role too. Engaging in regular physical activity, even if it's just a short walk, can boost your mood. Exercise releases endorphins, which are natural mood lifters. Eating a healthy diet, rich in fruits, vegetables, and whole grains, can provide the nutrients your body needs to function optimally. Getting enough sleep is also essential. Aim for 7-9 hours per night to help regulate your mood and energy levels. Avoiding alcohol and drugs can also make a difference. These substances can exacerbate depression symptoms and interfere with the effectiveness of medications. Instead, focus on staying hydrated and maintaining a balanced lifestyle. Practicing relaxation techniques such as deep breathing exercises or meditation can help calm your mind. These practices can reduce stress and anxiety, which are often linked to depression. Even just a few minutes a day can make a significant impact. Connecting with loved ones, even if it's just a phone call or video chat, can provide emotional support. Social connections are vital for mental health, and sharing your feelings with someone you trust can be incredibly therapeutic. Don't hesitate to reach out to friends or family members when you're feeling low. Engaging in hobbies and activities that you enjoy can also be a powerful way to combat depression. Whether it's reading, painting, playing a musical instrument, or any other activity that brings you joy, these moments of pleasure can provide a much-needed break from negative thoughts. Volunteering and helping others can also improve your mood and provide a sense of purpose. Acts of kindness and community involvement can create positive feelings and help you feel more connected to the world around you. Setting small, achievable goals can give you a sense of accomplishment and help you build momentum. Celebrate your successes, no matter how small they may seem. Each step forward is progress. Practicing gratitude can also shift your focus from what's wrong to what's right in your life. Keeping a gratitude journal and writing down things you're thankful for each day can help cultivate a more positive outlook. Joining a support group can provide a sense of community and understanding. Sharing your experiences with others who are going through similar struggles can be incredibly validating and comforting. Remember, coping with depression is a journey, and it's okay to take it one day at a time. Be patient with yourself and recognize that progress may be slow, but every effort you make is a step towards a healthier, happier life. By incorporating these coping mechanisms into your daily routine, you can take back control and improve your overall well-being. Stay hopeful and keep moving forward. Section 8. A light at the end of the tunnel. Hope and recovery. Recovery from depression is possible. It takes time, effort, and support, but with the right treatment and self-care, you can reclaim your life. Remember, you are not alone in this journey. Many people have walked this path before you and found hope and healing. Don't give up on yourself. Keep fighting for your well-being and never lose sight of the light at the end of the tunnel. Section 9. Remember, you are not alone. If you're struggling with depression, please know that you are not alone. Reach out for help. Talk to a trusted friend or family member, a doctor, or a mental health professional. There are also many resources available online and in your community that can provide support and guidance. For more helpful content on understanding and coping with depression, subscribe to our channel. Remember, there is hope, and recovery is possible. Take that first step towards healing today.